How can cytogenetics predict response to Venetoclax and azacitidine in MDS? Hello, my name is Dr. Jacqueline Garcia, and I'm a leukemia clinical investigator from the Dana-Farber Cancer Institute in Boston, Massachusetts. At EHA this year, in abstract S189, we presented the results from an exploratory analysis evaluating the outcomes of higher risk MDS patients receiving combination Venetoclax and azacitidine based on IPSS-R risk group and IPSS-R cytogenetic subgroups from the ongoing phase 1b clinical trial M15531. Venetoclax is a selective and potently oral bioavailable BCL2 inhibitor approved in combination with hypomethylating agents and low-dose cytarabine for patients with untreated AML who are not intensive chemotherapy candidates. Venetoclax blocks the BCL2 protein, which primes the cells for apoptosis and lowers the apoptotic threshold overall. Azacitidine increases BCL2 levels and indirectly decreases other anti-apoptotic proteins. The preclinical and clinical data suggests that Venetoclax synergizes with hypomethylating agent therapies, making it compelling for use in myelodysplastic syndromes. Patients were enrolled into this phase 1b trial based on the original IPSS criteria of intermediate 2 or higher risk disease. The revised IPSS or IPSS-R is an updated classification system that is more precise, taking into account detailed cytogenetic data compared to the original IPSS scoring, and thus arguably a better prognostic tool. At EHA 2020, we presented the results from our exploratory analysis to evaluate the outcomes of patients receiving combination Venetoclax and azacitidine based on IPSS-R risk group and cytogenetic risk classification. We hypothesized that robust responses would be observed across all cytogenetic risk groups, and with a median follow-up time of 13 months, we were able to analyze the outcomes of 57 patients who received combination therapy. We were highly encouraged that overall, 93% of patients achieved clinical benefit from treatment. In fact, the complete remission plus marrow complete remission, or marrow CR rate, ranged from 62% to 100% across all IPSS-R cytogenetic risk subgroups. Baseline next-generation sequencing performed on 38 of the 57 available samples revealed a spectrum of mutations commonly observed in higher-risk MDS populations. In fact, 15 of 38 patients had a mutation in TP53, and these very poor risk mutated patients were enriched among those that had very poor risk cytogenetics. At 12 months follow-up, a median overall survival was not yet observed across all IPSS-R cytogenetic subgroups. Overall, we have observed broad efficacy and tolerability for Venetoclax and azacitidine combination among patients with higher risk MDS, and in particular, we noted exceptional responses among those with very good and good risk cytogenetics based on IPSS-R criteria.